Hello, my name is Jacqueline Sun, and I am the Senior Policy Analyst with the Beach Cities Health District. And I'm here to give an update on COVID vaccinations and the rollout and provide some information to the public about what the prioritization is and where you are in line to get the COVID vaccine. And so at the Beach Cities Health District, we've been working with partners to kind of come up with a vaccine strategy with really the goals of providing accurate information to the community about COVID-19 vaccine and make sure that people know all the facts and really it addresses their concerns and limits vaccine hesitancy. We really encourage those to get the vaccine when it becomes available to them. This is an additional tool to fight COVID-19. And it's going to be a really important one to make sure that we reach that herd immunity threshold to make sure that the spread does not increase. And then we're also kind of aligning resources with our community partners in the community to just make sure that our community and our workers in the beach cities have access to the vaccine when it becomes available for each priority group. Making sure that we're communicating really clearly that, tier one or phase 1B, it's your turn, or phase 1C, it's your turn. And really, partnering with work sites, cities, schools to ensure that the communication is really clear. And so through our strategies, we're coordinating with LA County's rollout plan, but we're also identifying and coordinating with these partners to identify those who can receive vaccine or those registered vaccine providers with the specific sites, the infrastructure, the resources, the workforce that they need to maybe operate these sites, and connecting people who need to get vaccinated in those priority groups with these sites. So what does this rollout, how might it look? So as I said, we are currently in phase 1A right now, and a lot of this is happening through different avenues, right? If you work in a hospital, you're likely to be getting your vaccine through that hospital setting. If you work in a long-term care facility, if you live in a long-term care facility, you're likely to be getting it through those facilities and those sites. The county has also set up special vaccine sites for the rest of the healthcare workers that fall into phase 1A that don't work in a hospital, for example. So as I mentioned, as of today, January 11th, anybody in phase 1A is able to go to the county website and sign up for one of those appointments. You need to have proof that you fall in those categories through identification and a letter from your employer to verify that you fall into those categories, but those sites are available for people who fall into 1A. And the strategies for 1B and onward, it's going to be a combination of different strategies where, when the question is asked, where am I going to get my vaccine? Well, it depends. And I think that it can include a lot of different things from, pharmacy settings to community clinics, maybe your healthcare provider. If you are in a work site, maybe they have a closed point of dispensing just for your work site, like schools, other locations where they might have kind of these clinics for specific prioritized groups. So there's a lot of avenues where you might be getting the vaccine, and we're working on kind of coordinating those efforts to make sure that people know where is appropriate for them to go, and when it is their turn, that they have the right information. And the county is working closely with the state and community partners to kind of do some of that coordination. But just to keep in mind that we're working through the phases right now, and distribution is likely going to take many months as we are going through the process right now, probably not available to the general public until the spring or summer of 2021. And lastly, I just wanted to address vaccine hesitancy. It being a new vaccine, there's a lot of questions about, some concerns or questions that are asked about specific things about the vaccine. And so vaccine hesitancy, this question has been asked since the beginning of the pandemic in April. How likely are you to get the coronavirus vaccine? And as of mid-December, 72% of Angelenos said that they would, and 65% of people generally in the US. So, those numbers, we kind of need to increase those numbers to make sure that people feel comfortable, they have the information that they need. So the health district is working diligently on communication campaigns. We have town halls with physicians, different panels and meetings for people to ask their questions and make sure that they have all the information to make an informed decision. But we really do hope that we're able to get everybody who's eligible and a vaccine when it becomes available to them. So I would encourage you to check out our website at www.bchd.org/COVID vaccine for more information about the rollout, about FAQs, and we're here to make sure that our community has access and has the information they need to help end this pandemic. So thank you.